Hi and Assalamualaikum to my fellow and madam. My name is Nurul Imi Khalida binti Ahmad Nashuha, DNS 07210066. So today I want to talk about our topic, which is tuberculosis. But firstly, I want to tell you about the definition of tuberculosis. Basically, tuberculosis is a potentially serious infectious disease that mainly affects the lungs. It is caused by a bacterium called Mycobacterium tuberculosis, but it also can affect any part of our body, including the gland, abdomen, bones, and also our nervous system. Tuberculosis is caused by bacteria that spread from the person to person through microscopic droplets that release into the air. This is spread when someone with the untreated active form of tuberculosis coughs, speaks, sneezes, and also spits. There is two types of tuberculosis, which are active tuberculosis disease and latent tuberculosis infection. Active tuberculosis disease is a condition which Mycobacterium tuberculosis causes infection typically in the lungs, even though many systems that can be also involved. Meanwhile, the latent tuberculosis infection is the condition that tuberculosis bacteria that can live in the body without making you sick. People with latent tuberculosis infections have no symptoms. Patients who suffer tuberculosis will experience cough that lasting more than 3 weeks. It is often a first symptom of active tuberculosis. It can start as a dry irritating cough. In time, the cough produces a lot of phlegm or sputum, which may be bloodstained. Tuberculosis infection cause airway inflammation and driving airway obstruction, making airway smaller, which increases air velocity and displaces air to unobstructed areas. Thus, airway inflammation can result in prolonging Mycobacterium tuberculosis infection and make the movement of Mycobacterium tuberculosis to become healthy at the areas of the lungs. For the anatomy for our topic, which is tuberculosis, I will show the differences between the condition of healthy lungs and the condition of tuberculosis lungs based on the diagram 1 and diagram 2. So, based on my research and observation, the lungs of the tuberculosis patient became black. The infection destroys patient's lung tissue, causing them to cough up the bacteria, which then spread through the air and be inhaled by others. The mechanism behind this lung damage is poorly.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurani Nurain binti Rosli, DNS 109. Today, I want to talk about etiology tuberculosis. Tuberculosis is caused by bacteria, known as Mycobacterium tuberculosis, that spread from person to person through microscopic droplet released into the air. The bacteria infected have cell wall called mycolic acid. Mycolic acid is a cell wall that is invulnerable and difficult to fight off by antibiotic. Risk factor tuberculosis. Anyone can get tuberculosis, but certain factor can increase your risk. Number 1 is weak immune system. A healthy immune system often successfully fight tuberculosis bacteria. However, severe conditional medication can weak your immune system, like HIV or AIDS, diabetes mellitus, old age, severe kidney disease, and certain cancer having treatment that weak the immune system, such as chemotherapy. Number 2 is traveling or living in crowded condition, like homeless people, Africa, Latin America, and foreigner. Number 3 is poor lifestyle, like drug abuse, alcohol, and smoking, that can weak your immune system and make more vulnerable to tuberculosis. Number 4 is working in healthcare. Regular contact with people who are ill increase your chance of exposed to tuberculosis bacteria. Number 5 and the last one is close contact. Close contact is like working or living with tuberculosis infection. Tuberculosis infection not hitting in a short time. It take a long time. If one day is for each hour to get an infection with tuberculosis.
Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Nurhani Mitisa Jali. My matrix numbers is DNS 072100X1. Okay, next, I will present about the pathophysiology of tuberculosis. The whole cycle begins when an individual inhales a Mycobacterium tuberculosis, which presents in aerosol droplets discharged into the atmosphere by a person with an active infection. Mycobacterium tuberculosis travels down the airways into the alveoli of the lungs. The bacteria will start to multiply in the alveoli. Mycobacterium meets with the immune cells called alveolar macrophage. The bacteria are ingested by the macrophage, but manage to survive inside the macrophage. Internalizations of Mycobacterium triggers an inflammatory response that brings other alveolar macrophage to the area together. These cells form a mass of tissue called a granuloma. In the early stage, the granuloma has a core of infected alveolar macrophage enclosed by other cells of immune systems. As cellular immunity, which means the activations of phagocytes, antigen-specific cytotoxic T lymphocytes develops, the alveolar macrophage loaded with bacteria are killed, resulting in the bacteria become dormant but may remain alive for decades. This is referred to as latent tuberculosis. Latent tuberculosis and may persist throughout a person's life without causing any symptoms. The strength of the body's immune response determines whether the infection is arrested here or progresses to the next phase. In healthy pupils, the infection may be stopped permanently at this point, but if the immune system cannot keep the Mycobacterium tuberculosis under control, the bacteria can reactivate it and escape from the granuloma and spread to other parts of the lung, causing active pulmonary tuberculosis. The Mycobacterium tuberculosis may also spread to the organs of the body via the lymphatic systems or the bloodstreams, such as the brains, kidneys, bones, or spine. Okay, that's all from me. Thank you.
Next, clinical manifestation, which is sign and symptoms. Symptoms of TB disease depend on where in the body the bacteria are growing. It can occur in young children or immune-compromised individuals. Tuberculosis or TB may infect any part of the body. Once it gets into the body, it can spread to the lymphatic system and it can travel to the brain, joints, liver, spine, and kidneys. But TB bacteria usually grow in the lungs, called pulmonary TB, and the duration varying from weeks to months. Tuberculosis disease may cause symptoms such as a bad coughing that lasts for 6 weeks or longer, pain in the chest, and coughing up a blood sputum. Other than that, for other symptoms of TB disease are weakness or fatigue, weight loss, no appetite, chills, fever, and sweat at night. Moreover, symptoms of TB disease in other part of the body depend on the area affected. For example, people who have latent TB infection do not feel sick, do not have symptoms, and cannot spread the disease to others. But for those people who have active TB, this condition makes you sick and in most cases can spread the disease to the others. And when TB occurs outside of your lungs, such as tuberculosis of the spine, might cause you a back pain, and tuberculosis in the kidneys might cause you blood in the urine.
For the investigation of tuberculosis, there are a few ways to implement it. Number one is serological test. It is a blood test for tuberculosis, also called serological tests, are tests that are carried out on blood samples. Serological or serodiagnostic tests for tuberculosis mean diagnosing tuberculosis through looking at blood sample and specifically looking for antibodies in the blood sample. Number 2 is interferon gamma release assay. The interferon gamma release assay or IGRA test is blood test used to see whether a person has been exposed to the tuberculosis bacteria. The IGRA test is used to diagnose tuberculosis infection. This is when the tuberculosis bacteria is in the body, but the person is not experiencing any symptoms suggestive of tuberculosis disease. For the next investigation of tuberculosis is the Mantoux tuberculin skin test or TST. The tuberculosis skin test is performed by injecting a small amount of blood that are called tuberculin into the skin on the lower part of the arm. A person give the tuberculin skin test must return within 48 to 72 hours to have a trained healthcare worker look for a reaction on the arm. For the next investigation for tuberculosis is chest X-ray. The chest X-ray will usually appear abnormal when a patient has tuberculosis disease in the lungs. It may show infiltrates or cavities. However, chest X-ray result cannot confirm that a person has tuberculosis disease. A variety of illnesses may produce abnormalities whose appearance on a chest X-ray resemble tuberculosis.
Hello and Assalamualaikum. My name is Ainul Izzah binti Zainal Abidin, DNS 07210098. Today, I will present about medical treatment. Medical treatment divided into isolation and medication. For isolation room, such as respiratory room, is for foreign patients would have pulmonary tuberculosis. The two important aspects for tuberculosis are medications and diet. Patient must have a medication 6 to 8 months. Normally, it starts with IM injection every day for 6 months. Doctor will prescribe the antibiotic to kill the bacteria that cause tuberculosis. 2 antibiotic, isoniazid and rifampicin for 6 months. 2 additional antibiotic, pyrazinamide and ethambutol for the first 2 months of 6-month treatment period. This medication depending on patient's weight. If patient doesn't take any medication, the bacteria of tuberculosis will not die. Patient will have other complications. You may begin to feel better only a few weeks after taking the drugs, but treating tuberculosis is longer than any bacterial infection. Sometimes, antibiotic that patient use to treat the disease doesn't work. Doctor call this drug-resistant tuberculosis. Patient may need to take stronger medication for longer time. Diet helps to recover faster from tuberculosis. Antioxidant food help combat tuberculosis, fight bacteria, such as apple, watermelon, and low-fat protein. Increase your food of containing vitamin C. Patients who have tuberculosis must avoid from smoking and drinking alcohol. If you smoke while taking the medicine, it will affect your treatment.
Hello and Assalamualaikum to the Madam Siti Halus and Press. My name Nur Asmatatu Fariha binti Abdul Aziz. My matric number DNA 07210132. Today I will be present about nursing care plan, actual potential and rehabilitation. Actual number 1, difficulty breathing. Number 2, extreme exhaustion. Number 3, chest pain. Assessment. Number 1, objective. Short-term goal. After 8 hours of nursing intervention, the patient will report or decreased difficulty breathing, extreme exhaustion, and chest pain. Demonstrate improved ventilation, adequate oxygenation within acceptable range. Potential. Number 1, effective exchange. Shortness of breath is caused by a combination of poor gas exchange and low lung surface effectiveness. Number 2, comprehensive bacterial infection. Due to tuberculosis, a complex bacterial infection can induce significant weariness. Number 3, pneumonia in tuberculosis, inflammation of the lung that can cause chest pain due to tuberculosis. Nursing diagnosis impaired gas exchange relate to decreased the lung surface. Intervention and rationale. Number 1, assess patient general condition. Example, dyspnea, tachypnea, abnormal breath sound increase, respiratory effort, limited chest wall expansion, and fatigue. Rationale to plan for further treatment. Number 2, monitor vital sign, respiration rate, ABG, and SpO2. Rationale to assist patient immediately if patient develop respiratory compromise. Number 3, position patient in Fowler's position. Rationale for comfort and easy breathing. Number 4, limit patient activity. Rationale to reduce oxygen consumption. Number 5, provide oxygen therapy if required. Rationale to aid in correcting the hypoxemia. Evaluation. After 8 hours of nursing intervention, the patient was able to breathe as normal, respiration rate as normal, breathing pattern, secretion discretion, remain calmness, SpO2 above 95%. Rehabilitation physiotherapy. Number 1, physiological support. Emotional support must be provided to patients with tuberculosis and their families during illness. Receiving tuberculosis diagnosis is often regarded by the patient as a rare stigma which isolates him from patient and society. The psychology can support patients to help reduce misconception and to socially integrate former patients. Number 2, physiotherapy for bronchiectasis. SCBT is commonly taught technique and is often used with postural drainage and manual drainage. Its purpose is to loosen and clear excess pulmonary secretion, improve the effectiveness of a course, and to improve lung ventilation and function. It consists of 3 main stages. Number 1, breathing control. Number 2, deep breathing exercise or thoracic expansion exercise. Number 3, huffing or forced expiratory technique. Number 3, chest physio. To standardize the use of chest physiotherapy as a form of therapy using one or more techniques to optimize the effect of gravity and external manipulation of the thorax by postural drainage, percussion, vibration, and codes. A mechanical percussor may also be used to transmit vibration to lung tissue. Chest physiotherapy is administered by a licensed respiratory care practitioner trained in the procedure. Training must be equivalent to the minimum entry level in the respiratory care service with the understanding of its specific requirement of the patient population treated. Next, rehabilitation OT. Number 1, counseling. Patient need to be told the tuberculosis is a fully curable and treatable disease. We must use patient-centered approach and recognize that all tuberculosis patients require a minimal package of holistic tuberculosis care services that are not restricted to diagnosis and pharmacological treatment but include counseling and support service as well. Number 2, exercise. Physical exercise is recommended for respiratory condition, included bronchitis, with the aim of improving aerobic capacity and fitness and endurance. A study by Lee et al. Included that exercise resulted in short-term improvement and had an impact on dyspnea and fatigue and result in favor exacerbation over a 12-month period. That's all from me. Thank you.
Assalamualaikum, my name is Nur Shazliana binti Abdul Ghani Zukri. My matric number DNS 07210034. Tuberculosis complication includes spinal pain, back pain and stiffness are common complications of tuberculosis. Joint damage, tuberculosis arthritis usually affect the hip and knee swelling of the membrane that cover brain. Meningitis, this can cause a lasting or intermittent headache that occur for weeks. Mental change also. Liver or kidney problem are kidney help filter waste and impurities from bloodstream. Dysfunction become impaired if the liver or kidney are affected by tuberculosis heart disorder. Tuberculosis can affect the tissue that surround heart, causing inflammation and fluid collection that may interfere with heart ability to pump effectively. This condition called cardiac tamponade can be fatal if test positive for latent TB infection. Dr. Mess advised to take medication to reduce risk of developing active tuberculosis. The only type of tuberculosis that is contagious is the active variety when it affects the lungs.